Hey, good afternoon, good morning, whatever time you're watching this. I wanted to take a little bit of time and talk to you about what type of treatment we can offer and whether this type of treatment is for you or not. Um, Oftentimes I get asked, like, what is myofascia? What is myofascial release? And what type of work do you do? And what's the difference between you and another therapist? And do you take my insurance? There's a lot of good questions, and I want to hit them square ahead. What is myofascia? Myofascial release is a integrative approach that really focuses on finding the root connective tissue problems in your body. That's it. I can't make it any more simple than that. Typically, where you're having the pain is not where the real origin of the pain is, unless it was trauma or pathological. And so it's my job as your clinician to find where the root problem of it is. It could be from the front, it could be from the back, it could be above or below, it can be all the above. Quite frankly, it usually is all the above after bad habits and compensation. But if you've tried other interventions, if you have medicated for it without results, if you've tried other physical therapy, conventional, specialized, whatever, and you still haven't had a result, I urge you to try it. Come for a free consult. It doesn't cost you anything. 30 minutes of my time, we can talk about it. It can be very straightforward to find out if just from your history and your symptoms, whether I believe a myofascial release intervention approach would be right for you. Don't hesitate to give us a call. Another question is, do you take my insurance? Well, as of this year, we are not taking insurances. Not by my choice, but by insurance metric choices that have been forced upon me. Insurance is wonderful for acute, traumatic, life-altering events. I've used it. I'm glad I had it. I fractured my clavicle 3 years ago, needed 3 surgeries for it to get repaired. I'm glad I had insurance. I've had 3 children with my wife, and we're glad we had insurance because insurance covered a grand majority of it. But insurance isn't always the best avenue to take care of your current quality of life and impairments that are not traumatic. Let me explain. Insurance doesn't care how good you feel. They just don't. I know. I used to work as an insurance-based therapist for over 10 years. And I understood very quickly that the metrics that the insurance company wanted for you to get well in didn't agree with how you felt as a patient. So I started understanding that there needed to be a different approach. There needed to be a longer term approach, an approach in which the clinician got to decide, what an ironic situation, what was the best way to treat this human frame. So now I have the autonomy to treat you in the best clinical sound judgment that I have practiced, learned, and implemented. And that's through a manual intervention for a prolonged period of time. Time and pressure is the key ingredient to the majority of all connective tissue dysfunctions. How you do it, where you do it, that's the art and science of it. And so if you are interested in an approach that is not handcuffed by an insurance billable paradigm, and a billable clinician mindset of how many units can I bill out of this unit or this patient in this given time frame, if you're interested in an approach that is holistic, whole body, head to toe approach, give us a call. I will be happy to talk to you. I will be happy to discuss these items with you. And if this is an approach for you, or if someone you know, or if you have been let down by other approaches that you thought were, well, that's all that's out there for me, again, I urge you, give us a call, look up our website. It's free to ask questions. It's free. I'll be happy to talk to you about them. Thanks for listening. Have a good day. Bye.